Hello there, welcome to Ulnar Nerve made ultra easy tutorial. In this tutorial, we will be looking at the origin and cause of the ulnar nerve, as well as the muscles and sensory supply of the ulnar nerve. Let's look at how it began. The brachial plexus is where the ulnar nerve originated from. The brachial plexus is made up from C5 to T1 fibers, meaning C5, C6, C7, C8 and T1 fibers. They then form the roots, trunks, division, cords and branches. From the medial cord is where the ulnar nerve originated from. Together with the medial pectoral nerve and medial cutaneous nerve of the arm and forearm, as you can see pointed by the arrows. Hence, the ulnar nerve takes C8 and T1 fibers and sometimes even C7 fibers. Three other very important nerves of the upper limb are the median nerve, the axillary nerve and the radial nerve. Now let's look at the cause of the ulnar nerve after arising from the medial cord of brachial plexus. After arising from the medial cord of the brachial plexus, the ulnar nerve runs in the axillary region, or otherwise known as the armpit region. It runs between the axillary artery and the axillary vein. It then continues into the arm. As the ulnar nerve runs distally from the axilla, it reaches the arm. It lies in front of the insertion of teres major muscle and long head of triceps, as well as medial to the brachial artery. In the middle of the arm, the ulnar nerve pierces the medial intermuscular septum and enters the posterior compartment of the arm. Here, it lies and runs between the medial intermuscular septum and medial head of the triceps muscle. There is a connection between the intermuscular septum and the medial head of triceps, which is known as arcade of Stratus. The ulnar nerve then continues to run in the posterior compartment of the arm down into the elbow region. As the ulnar nerve reaches the elbow, the nerve runs behind the medial epicondyle of the humerus into the cubital tunnel. The cubital tunnel is bounded medially by the medial epicondyle of the humerus and laterally by the olecranon process. This is where we call it the funny bone. You could feel your own ulnar nerve if you put your palm of your fingers in between both the bones at the medial side of your elbow. At this point, the ulnar nerve is superficially palpable and hence prone to injury. Some points to note: the ulnar nerve does not lie in the cubital fossa. The ulnar nerve lies in the cubital tunnel instead. As you can see, the ulnar nerve has not given off any branches, be it muscular or sensory. It does not give any branches in the arm. The ulnar nerve only gives it in the forearm and hand. Now let's take a look when the ulnar nerve moves into the forearm. The ulnar nerve enters the forearm by passing between two heads of flexor carpi ulnaris. It then runs between the flexor carpi ulnaris and flexor digitorum profundus in the medial side of the forearm. Both the flexor carpi ulnaris and flexor digitorum profundus are flexors of the wrist and distal interphalangeal joints respectively. We will look at these muscles later in the next tutorial. As it descends further, the ulnar nerve gives a dorsal cutaneous branch before entering the wrist. This branch supplies sensation to the dorsal aspect of the hand, which will be talked about later. Continuing, the ulnar nerve enters the wrist, lying superficial to the flexor retinaculum. As you can see, the palmar cutaneous branch is given out before the wrist, but it also enters the wrist. It supplies sensation to the palmar aspect of the medial 1.5 digits of the hand. This will also be discussed later in the tutorial. As I mentioned earlier, the ulnar nerve enters the wrist, lying superficial or above the flexor retinaculum. It then gives off several branches. Firstly, to the hypothenar muscles, which otherwise known as the muscles that are attached to the little finger. Then it gives a deep motor branch to the lumbricals, the palmar and dorsal interossei, as well as the adductor pollicis. Only the medial two lumbricals are supplied by the ulnar nerve. The rest are supplied by the median nerve. It then ends with a superficial sensory branch to the medial 1.5 digits, otherwise known as the little finger, and half of the ring finger. This is the palmar surface of the hand. As mentioned earlier, the ulnar nerve gave a palmar cutaneous branch and terminated as a superficial sensory branch which supplies the medial side of the palm and 1.5 digits for sensation. The median nerve supplies the rest of the fingers and the palm, while the radial nerve supplies the skin over the thumb. In the dorsal surface, the dorsal cutaneous branch supplies the medial side of the skin of the hand and the medial 1.5 digits as shown. This dorsal cutaneous nerve was given out before the ulnar nerve entered the wrist, meaning if there was a lesion or an injury at the wrist, the dorsal sensation will be spared. The median nerve supplies the digits as shown, and the radial nerve supplies the rest of the dorsal surface of the hand. Let's now recap the cause of the ulnar nerve. It arises from the medial cord of the brachial plexus, runs down between the axillary artery and vein, in front of the insertion of teres major. It then pierces the medial intermuscular septum in the middle part of the arm to enter the posterior compartment, where it runs between the septum and the medial head of the triceps brachii muscle. It then enters the cubital tunnel running behind the medial epicondyle of the humerus. It then enters the forearm running between the two heads of the flexor carpi ulnaris. It continues between the flexor carpi ulnaris and flexor digitorum profundus in the medial forearm. Enters the wrist superficial to the flexor retinaculum, where it gives motor branches to the hypothenar muscles, gives deep motor branch to the intrinsic hand muscles and the adductor pollicis, and it ends by terminating as a superficial sensory to the medial 1.5 digits. What does the ulnar nerve supply? It does not supply anything in the arm. It starts off in the forearm by supplying the flexor carpi ulnaris, the medial two flexor digitorum profundus, the hypothenar muscles, the adductor pollicis, palmar and dorsal interossei, as well as the medial two lumbricals. It gives off sensation by the dorsal cutaneous nerve to the ulnar side of the dorsal surface of the hand and medial 1.5 fingers, and via the palmar cutaneous nerve and the superficial sensory terminal branches to the ulnar side of the palmar surface of the hand as well as the medial 1.5 fingers. We have now come to the end of tutorial 1. Do take a look at tutorial 2 and tutorial 3 videos where we will be talking about the muscles supplied by the ulnar nerve as well as clinical lesions of the ulnar nerve. There are some summary notes below this video and quizzes for you to try. I would like to thank you for watching Ulnar Nerve Made Ultra Easy tutorial. Goodbye!